Hi, my name is Amy Perlman, and I am a urologist and sexual medicine specialist. Sexual health concerns in people of all genders are common, especially during and after cancer treatment. Sexual health concerns for penis owners include difficulty getting and maintaining erection, delayed time to reach orgasm, inability to reach orgasm, reduced or absent ejaculation, decreased genital sensation, and loss of desire. Sexual health concerns for vagina owners include difficulty reaching climax, vaginal dryness, vaginal tightness, genital pain with touch and/or intercourse, and loss of desire. Cancer, as well as treatment for cancer with chemotherapy or other medications, radiation and/or surgery, can result in short and long-term sexual problems for people of all genders. Early intervention can help optimize and restore tissue health. Top 3 benefits for addressing sexual health concerns during and after cancer treatment. Number 1, preserve and restore health of genital tissue. Number 2, improve genital pain with touch and/or intercourse. And number 3, allow for continuation of intimacy during and after cancer therapy. The good news is we have a lot of recommendations to help optimize your sexual health. When it comes to lifestyle changes, exercising and eating healthy food can help desire and sexual function. Sometimes extra visual, physical, and genital and non-genital stimulation can also help. For penis owners, here are some specific recommendations. Medications that you can take by mouth, pills such as Viagra and/or Cialis, can help in a lot of people restore erectile function. Advantages are that they are non-invasive, cost-effective, have high rates of success, and are often well tolerated. In most people, those pill options will work, but they won't work in everyone, and we have other therapies for those folks. Intraurethral medication is medication that's placed inside the urethral tube, or that tube that you urinate out of, and this can be used prior to a desired erection. It is more effective than the pill medications. Advantages of these therapies are that there are no needles, the erection can occur within 5 to 10 minutes of actually using the medication, and they can be used with other therapies to help maintain the erection. Another option are penile injection therapies. Now, this is when medication is injected into the penis prior to a desired erection. This is going to be the most effective medical treatment for erectile dysfunction. Now, advantages of this therapy includes that it's the most effective treatment for ED. The onset of erection is pretty quickly after using the medication, within 5 to 10 minutes. Vacuum erection devices are another tool in our toolbox. A vacuum pump pulls blood into the penis. A ring is placed around the base of the penis to keep the blood in before sexual activity. These are also really great options for daily exercise of penile tissue for men who are not getting daily erections. Advantages of vacuum erection devices are that they are drug-free, non-invasive, they can be used with other therapies like the pills, the constriction band, the medication you put in the urethra, or penile injection therapy. And they are incredibly useful tools to preserve or restore genital tissue health. Now, traction devices are also another tool that we have. They kind of sound a little interesting or odd, but they can actually help reduce loss of penile length when used on a regular basis. The advantages being that they are drug-free and non-invasive as well. Penile constriction bands are a very underutilized tool that we have in our armamentarium. So these penile constriction bands can be used by themselves or with any of these other therapies that we've discussed. They can help maintain an erection by placing it at the base of the penis to prevent the blood from leaving the penis. Now, some bands are also designed to go around the testicles, which some men may prefer. Advantages of these therapies are that they are drug-free, they can be used with the other therapies like the pills, the vacuum device, the urethral medication, or penile injections to help maintain that erection for you. And then we have surgical options. So this is when we put a penile implant, so we replace the hydraulics in the penis, and oftentimes we'll put in an inflatable device. Now, this therapy works by squeezing a pump that sits in the scrotum. We don't have to remove the testicles to use this therapy. And it actually moves fluid into the cylinders inside the penis to create an erection. There's a separate deflate button on the pump that's squeezed to return the penis to a soft and natural-looking state. Advantages of this therapy are that they are drug-free, provide reliable erections, and are covered by many insurance plans. Now, let's go for vagina owners and the recommendations that we have for those folks. So you want to consider vaginal moisturizers or lotions, and these can be water or silicone-based vaginal lubricants, low-dose vaginal estrogen replacement. Experiment to find comfortable positions for intercourse. This may look different from what felt comfortable and enjoyable a year ago or 2 years ago, but it can be fun to experiment with different positions. Also consider using vaginal dilators, as these can help restore vaginal width, depth, and elasticity, especially if for those who have a local therapy to the pelvis with, let's say, surgery and/or radiation. Also consider vibrators for additional stimulation, and consider meeting with a specialized pelvic physical therapist to learn techniques to relax the muscles surrounding the vagina. In a lot of vagina owners, the main concern is pain with sexual activity, and not even just intercourse, but even with touch. So figuring out how to optimize the health of the genital tissue in vagina owners is really critical to not only tolerating sexual activity, but even enjoying sexual activity. Let's talk about common challenges. The first challenge is going to be cost. Some of these therapies can be costly and may not be covered by insurance. Medication assistance programs and speaking with your healthcare provider for advice on cost-effective pharmacies are critical to actually being able to try these therapies. Number 2 is communication. Talking with one's partner about what feels good and what doesn't can be a difficult conversation to have, and we acknowledge that. And number 3, not every treatment will be successful, and that can be discouraging for both patients and partners. Now let's talk about 3 helpful tips for addressing these common challenges. To talk about cost, well, there are these medication assistance programs and pharmacies that can provide these therapies at a low and affordable cost for patients. So finding out where those places are is going to be critical. Number 2, communication. Consider these conversation starters. What feels good? What does good sex look like? How comfortable are you communicating your level of pleasure, displeasure during sex? Do you have any sexual goals, dreams, fantasies? And what excites and scares you about sex? So think about those questions as they relate to you and perhaps your partner. And number 3, give yourself some grace. Some treatments may not be successful when it comes to improving sexual health, especially when it comes to during and after cancer care. Whatever feels good is good. Whatever hurts, stop doing. Because there are so many options for improving sexual function and pleasure, there truly is hope for everyone.